Welcome back. Time for this week's Ask the Vet segment with Dr. John Faught, Medical Director of the Firehouse Animal Health Center. First up, a viewer question submitted to us from, let's see, this is from Martin Sewell. He's got a question about his dog, Rhino.
Hi, this is Rhino. We had to get his eye removed 2 months ago, and I was just wondering, what are the chances of the other eye getting affected, and what can I do to prevent that?
Yeah, it sounds like you said it was an infection that was the cause. Rhino is a Boston Terrier, and so Boston Terriers, their eyes are just anatomically, they kind of stick out a little bit further, so they're more prone to injury and things like that. We'll see some that get chronic dry eye or glaucoma. I think as far as infection, we generally would like to medically treat that if we can, but if we can't get it under control or if the dog loses its vision, then removal of the eye sometimes is the best thing to take away any pain or discomfort that's there. And so I would expect that that's probably not something to expect with the other eye. It was probably either a traumatic induced or something else that set off the infection. I don't think it's something to anticipate that the other eye is going to be affected. Okay.
Moving on, a viewer question from Adam. With spring approaching, should I get the rattlesnake vaccine for my dog?
Yeah, the rattlesnake vaccine is actually an interesting thing. It's only been out for probably the last 5 to 10 years, and it's something that actually helps neutralize the venom of snake bites. And so it's been a really good thing for dogs who are prone to rattlesnakes. So the dogs that hunt, they go to the country a lot, they do that kind of stuff. They're in rattlesnake endemic areas. It is something really to consider in the springtime is when you want to do it.
Sure, and we've got some, of course, around our area as well. And then a follow-up question to that, does the rattlesnake vaccine protect against any other snake bites?
We believe that it does have some cross-protectiveness against other pit vipers. So copperheads, water moccasins, things like coral snakes would be the other kind of main poisonous snake we see in this area, and we don't believe that it has. They're a totally different species of snake, and their venom is very different.
Okay, got it. Question number 4, another follow-up, are there any other options for protecting my pet from snakes, other snakes out there?
Yeah, so what we generally encourage people to do, dogs that are really around rattlesnakes, you know, are in areas where there are a lot of rattlesnakes, you want to try to clear out brush, you want to take away, I mean, to get rid of snakes, you really want to try to get rid of their environment habitat, heavy brush, cluttered areas where potentially bait, mice, and rats and things might be living. So around your house, that's a good thing to try to clear all that stuff out. If it's out in the country, then one thing to consider other than the rattlesnake vaccine is you can do snake aversion training. There are some people around Central Texas that will actually help train your dog that when they hear that rattle of a rattlesnake to go the other direction rather than to be intrigued and go after it.
Interesting. And continuing on the snake topic, if a pet does get bitten by a snake, what should owners do? Because it's my understanding that the shot buys you time to get it to a vet.
That's correct. It does. It helps you. What we hope from the rattlesnake vaccine is that it does buy a little bit of time. It helps to lessen the severity of symptoms, but we still take all rattlesnake bites seriously because the reactions that take place in the body from the venom can be very serious. Some of them end up being pretty mild and not a big deal. We kind of treat them supportively and they get through it, but others are a bigger deal and require antivenom and some of the same treatments that a human would get if they were to get bitten.
And is it a one-time deal, or do you need to keep getting the shot on a regular basis?
The rattlesnake vaccine? The rattlesnake vaccine, we generally, the first time they ever get it, we give it once, we boost it about a month later, and then I generally, with my clients, we tend to do it on an annual basis and do it kind of in the late springtime, because that's the time they're going to be most likely exposed, is the late spring and summer. People have historically done it on a more consistent basis, doing it every 6 months for dogs that are, you know, they live on a ranch, they're always around snakes, but most of my clients do it on an annual basis, trying to cover against the 6 months they're most likely to be exposed.
All right, Dr. Faught, thank you. And you can send your videos and written questions to AskTheVet at KXAN.com, and Dr. Faught will answer them next Wednesday.